Good afternoon, everyone. My name is Brandalin Rego. Welcome to my presentation on social media's effect on the mental health of today's youth. I just wanted to start things off by asking everybody a quick question. Do you remember what it was like to be a teenager and you didn't have a social media device and you had to plan to hang out with your friends in advance, and when you set a time, you were there because you couldn't back out, because you couldn't get a hold of your friends, and if you were the one waiting, you were patient, because this is the time you agreed on. It really feels like that's a thing of the distant past. Today, our youth can back out of commitments with a quick text or the click of a not going button on an event just before they're supposed to arrive. Many won't even commit to anything anymore, just in case depression or something comes up, or maybe there's a better event going on and they want to go to that instead. There is an overall lack of closeness now that everyone can just monitor what's going on. This guise of being connected has put us further apart than we have ever been before. The problem is teens are constantly on their social media devices now. The Pew Research Center conducted a two-part survey, first in 2014, 2015, and then again in 2018. Teens have reported in 2014 and 2015 that 24% are almost constantly on their devices, 56% reported that they were on several times a day, and 20% said less often. Now, Pew ran this survey again in 2018, and we see a huge jump in almost constantly. We've almost doubled our percentage of teens, and you can see that that's coming away from several times a day and less often. So, teens are more consistently on their social media devices, and this is a huge part of what's affecting our mental health. Is it enough to be related to the increase of depression and suicide we're seeing in the United States? A group called Clinical Psychological Science published a research article in 2017 that compared two nationally representative surveys conducted to correlate increased social media usage with depression and suicide in today's teens. Their findings have surmised that this is correlated to an increase in mental health issues, an increase in physical health issues, and unfortunately an increase in teen suicide. I quote, "Adolescents who spent more time on new media were likely to report mental health issues, and adolescents who spent more time on non-screen activities, such as sports, exercise, homework, print media, and attending religious services, were less likely to report this." Since 2010, iGen adolescents have spent more time on new media screen activities and less time on non-screen activities, which may account for the increase in depression and suicide, unquote. It is clear that the extended usage of smartphones and social media is having an effect on today's youth. Faced with such staggering data, we are left wondering, what can we do to help our youth? With the rise of depression and mental health-related deaths occurring in the U.S., we must take action. What can parents and educators do to combat this epidemic? The first course of action is to keep an open line of communication with them and spend time with them. Open communication is vastly important in any relationship. The next thing we can do is use these parental controls that come built in with our social media devices. Many parents let their children have unlimited access to the internet at a very young age. I have seen this with myself and my siblings. I believe limiting the usage and forcing our youth to use their time differently is another powerful action that can be taken to combat this epidemic. And lastly, in lines with spending quality time and keeping an open line of communication, we can educate our youth on mental health, The individuality and obsessive disorders related to social media appearance can be very impactful. So teaching them about mental and emotional health and how to really maintain a social media and life balance, because it's apparent social media is not going anywhere, so we have to learn to work with it. Only we can bring about the change that we want to see in today's youth. This concludes my presentation. I hope that I have helped identify the correlation between social media and teen mental health issues and teen suicide. I hope I have helped you understand what we need to do in order to combat this social media epidemic. And I hope we can take the steps necessary to help our youth live happier lives. Thank you so much.